Good evening and welcome to Viewpoint, filmed this afternoon on the rooftop of number 6 Convent Place, the office of the Chief Minister, who's kindly allowed us to use this space to speak to the Director of Public Health, Dr Sohail Bhatti, on this beautiful autumn afternoon in a socially distanced interview outdoors. Good afternoon, Dr Bhatti, and thank you for joining us. Cases today are the highest they've been since the pandemic started, 88 positives. We've had 13 new cases yesterday, 15 new ones today, and there are 2 people in the COVID ward, 1 in critical care. Are you concerned?
Of course, I'm always concerned when there's a rise in cases. However, it has to be looked at in terms of the relative things that we're doing. So, of course, when we had the surge 1, which was in March, April, finishing in May, we weren't swabbing as much, so we didn't have as much test information as we have now. We did do a prevalence survey at the time, a quick rapid one done over a week. I know lots of people have gone over the coals on that one, but we roughly were anticipating that we had identified somewhere between 1 in 10, 1 in 20 of active cases at that time. So what we were picking up in Surge 1 were really the worst end of the scale, people who were symptomatic, who were really ill. I think what we're finding at the moment is that we're picking up people who are at the milder end of the scale, because we've got, we hit 1,000 tests done last week, and we're now perhaps 7 or 8 times higher in terms of our swabbing enthusiasm, if we put it that way. So that means we are picking up more cases, and we are picking up the milder end of the spectrum. Yes, there are people in the hospital. From what I understand, most of those 2 people aren't giving us any cause for concern. I believe at least 1 is just waiting to be moved back home, and there's just an abundance of precaution taking place to make sure that they're sufficiently safe to be moved to an elderly setting.
1 is in critical care.
And the ICU, the person's just getting a bit of oxygen, not really requiring any support. It's just as a precaution they've been brought in. Now, what I know and what I tell everyone, the politicians, is what we have today, 2 to 4 weeks later, we begin to see the consequences, because not everyone necessarily falls ill immediately. They have the normal run of things where they get cold-like symptoms, they've got a cough, and then some people begin to develop more breathing difficulties, and it's at that point they seek help, and they may then be admitted to hospital, and if things don't go well, they go into ICU. And that's the other thing to bring to people's attention, is we've got better at treating it. So we have different ways. We've managed to get hold of some remdesivir, and we're also in receipt of copious amounts of dexamethasone. So there are things we can do which we didn't do before. You remember then it was a completely new virus. We really didn't know that much about it. It's a two-way street on this one. Yes, it is predominantly a respiratory virus, but this is a trickster of a virus. It's a joker. It pretends to be one thing, but once it gets into your bloodstream, it can attack your brain, it can attack your lungs, of course, but it can attack your kidneys, and it also upsets your clotting system. And we know that the majority of people that die have significant problems with the clotting system. This is knowledge we've acquired since then.
You say that obviously we're doing much more testing now, but how do hospitalizations compare? Because the comparison is inevitable between now and in March, when Gibraltar moved to a lockdown. How do hospitalizations compare, if you recall?
Well, we've got negligible numbers. I mean, the wards are empty of COVID patients. They are actually full of people that are having treatment, which is perfectly appropriate. One of the things we learnt was that people continue to develop cancer, people continue to have needs and pains, and they need joints addressing, and we continue to provide a service. That does mean that we've got fewer beds. I think in the first wave we managed, or surge is probably a better word to use, we emptied the hospital in anticipation of the experiences they got in Lombardy and in Madrid, and it was our great fortune, and thanks to the good sense of the people of Gibraltar who went into a lockdown situation, that we were able to strangle the virus before it spread. So in effect, we are much, much better off.
Notwithstanding, if you were to plot the cases, active cases, on a graph, as I know you are doing, it is a fairly steep curve and climb up at the moment.
We're not comparing like with like, of course, and in fact I've asked my analysts to try to rebase the figures based on the fact that we've got more testing. It's inevitable, isn't it, that the more tests you do, the more you find, and that's a question I'm asked, you know, where do we really stand? And if we are testing 7 times more often, then how do we compare with the first time there was a surge? So we need to rebase, and it's tricky. It's not straightforward just pulling the chart axis down. You have to do a little bit more manipulation. But yes, there is a rise. There is a relentless rise, but it's percentages, and it's not as steep as you make out. Just because, remember, Gibraltar's strategy in terms of containing the virus is really dependent on us finding the virus as soon as it becomes manifest and creating a firebreak around it and containing it. The other options that other places are using are things like regional and local lockdowns. We haven't got regions, you know, you can't be that local. Mm-hmm. So our option has to be to find the virus quickly. So that's why we have I think the 3rd highest rate of testing per capita in the world. That's not by accident, it is by design. It is part of our protective mechanism.
Are there any patterns that are discernible from the positive cases that you've been able to identify and perhaps have a rethink about how you try to put in place that firebreaker?
So one of the problems with the last few weeks is we've been putting in a lot of effort to try to expand our capacity. Inevitably, when you're expanding your capacity, your attention moves a little bit away from doing the routine work to trying to get the new work done. We've recruited a lot of lab staff and we're getting our capacity up to 1,000. Therefore, you might not think it logical, but it does follow on. We couldn't then do lots of swabbing because there was no point in swabbing people if we were having to take 2 days to go through it. So we had to push that back a little bit. So I got a little less of the intelligence that I would like. Now that will be addressed. Now what we do know at the moment is we're getting outbreaks in workplace settings. So whether it's a solicitor's firm, whether it is actually still about 1/4 of the people that we have are still healthcare and social care workers. That's been a constant theme throughout Surge 1 and Surge 2. So what we are finding, and I think it was consequent on schools opening, is, and I had to make a decision, you know, what is in the benefits of, what is beneficial to our children, first and foremost. And I know that was one of the drivers around the lockdown in Surge 1, because people wanted to protect their children. We didn't know enough about it. COVID doesn't really harm children. Yes, of course, there are a few documented tragic cases of loss, but out of 5 million children in the UK, there have been 6 deaths, only one of whom they couldn't quite account for. The others had quite serious illnesses, developmental illnesses. They were expected not to do well. So that's a 1 in a million chance. So on that basis, I looked at the welfare of our children and I said, the fact that our children will have fear instilled in them, they will become insecure and uncertain, they will grow up with neuroticism and anxiety for their whole life. It will affect their social development, their physical development, it will affect their physical and mental development as well. That unfortunately the balance is very much not to overprotect them from something that doesn't do them any harm, and therefore the protocols we put in place in schools was one that enabled them to go back to as near normal as we could possibly imagine. I don't want our kids to be remembering COVID 70 years later because it's left them with a phobia or extra anxiety. So I knew that when we did that, we would have more spread in schools. From a children's health point of view, that's not a problem. But children go home, they sit in the bus.
Have you got a special message though for elderly parents or children who live in a multi-generational household?
And that very much is the same message we've been giving all the way through. That message has not changed. You are at increased risk if you are 70 and above, and you should take precautionary measures as you can. It is particularly difficult if you're in a multi-generational household, because distance between you and someone who shares a house with you is problematic. But generally most people live in other kinds of accommodation, and we've spoken to the elderly and said to them, by all means go out, by all means exercise, by all means mix, but do it with caution. Protect yourself at the end of the day, because we know, and Chief Minister said this at the start, for us a single death is a tragedy, and whilst individuals can make the choice, we as a community will suffer when something untoward happens.
So the precautions are plenty of ventilation, windows open, use a mask if you can't social distance, wash your hands regularly?
Absolutely. WHO gives us 3 C's as a quick way of remembering. Crowds, contact, close contact, and the third one is closed spaces. So if you've got all 3 of them, that's a place where the virus will spread. If you're outside, there's less chance of the virus spreading. And if you have physical distancing, like we have, there's even less chance of it spreading. And if you can avoid crowds, then there's even less chance of it spreading. So things that are done outdoors, I know the climate is going to change and we're expecting rainfall, but generally things that are done outdoors are safer. It's relative risk. You know, every time you cross a road, you take a risk. Every time you get on an airplane, you take a risk. It's knowing that risk.
Who is getting COVID-19? Is there a demographic profile at the moment?
Yeah. So it's working age people mostly at the moment. Like the rest of Europe and other places, it's the young people that are spreading it, 20s, 30s. The average age at the moment is around 40, 41. The thing that I worry about is the elderly getting it, but by and large, young people are going out, they're going to Chatham. I hear about people having raves, surreptitious parties. I really don't want people to think that I'm a killjoy. People should be able to, particularly in these times, where we'll remember this for a long time, it's having an impact on our mental well-being. But the point is we change our behaviour to save the lives of our grandparents, number one. Second thing that I'm trying to say is you do all of this to save your friend's job. Because if a company has to shut down because it's got a lot of virus, or if, God forbid, we have another lockdown, then businesses will crumble and you won't have a job. That's why you're doing it. You know, I understand there's a personal choice, but part of that personal choice for Gibraltar is what's in the best interest for us and your friends that you're going out with, and it is that they have a job, that they have a future.
I never get not even a cold, but this time I got a cold and I had to stay at home. So I stayed for 2 weeks because I wasn't feeling very well. I was feeling very tired. No,
and she's still tired.
And still I'm not well.
Yeah.
I've just come out because to change.
We need fresh air. But
and I need to walk because my legs get thick. It's not so bad when you've got somebody else at home. But I've been 2 weeks on my own and not feeling well. But now, thanks God, I'm okay.
It's been awful. Like, you know, I couldn't go to hospital to see my brother, for example. Like, I didn't know what was going on. He spent quite a lot of time, I think about 2 weeks in the ITU. As he got worse, we didn't know, like, you know, get into information. We couldn't go and see. It's a terrible thing, even with deaths. You know, like when something like that happens, you know, you only get like your direct family to see the person, and it's just. I think it's a really serious thing. That's what I really believe.
I know that you've addressed this on camera with GBC just a few weeks ago, but I've been asked by a few people to ask you if you have any regrets about making dire predictions back in March, and if you think that in any way it contributed to some people not believing in the seriousness of the virus. something about the fable of the boy who cried wolf.
Yes, of course. Now, I was in the same position as everybody else was. The difficulty with prevention is not everyone can see the risk. So I've got to say, I was extremely anxious at that time because I saw this tsunami coming towards us and I wanted to protect us. And I did what I thought at the time was sufficient to get us there. Now, I did cry. I blew the whistle on this one. This was a real risk, and I blew the whistle fairly early on, and that added to what people were seeing on TV. They were looking at Italian TV, Spanish TV, UK TV. It was all telling the same story. No one on earth can coerce Gibraltarians to go into lockdown. They decided for themselves. So I was part of a message, I wasn't the whole message. Of course there's been a cost to mental well-being. I do regret that. I wish there was another way to do it. But if I had said, as some of my colleague doctors said, you're scaring us and just calm it down, would we be in the position now? I know I would have said, if you'd asked me in February that we had had no death by October, I would have said you were mad. So if that's the outcome measure, then we have been successful, but it's also our hostage to fortune because we're only going to, it can't stay like this forever.
I think he's doing a very good job.
No, to keep up the good work, basically. I think he's doing very well, even if people criticize him.
There's very little I can ask him. I think he's doing a perfect job, and we should be grateful to him, really. I think we're in very good hands.
People do stop me in the street, I know, and do express their thanks, and I'm utterly grateful, and I continue to apologise. I've not got enough time to talk to people because I'm usually rushing between number 6 and the GHA or some other meeting. And I would also like to give credit to everyone I've worked with. The amount of hard work people have put in. I even dream of COVID now, so I don't even get a chance to go into Never Never Land when I sleep. I'm utterly amazed at how much effort and hard work lots and lots of people, from civil servants through to the average man in the street. We deserve, as a whole community, we deserve a collective thanks.
Let's hope it can be continued for months to come. The Chief Minister, who's kindly allowed us to conduct this interview on his rooftop today, asked people for honesty when speaking to the Contact Tracing Bureau. Does that imply that there has been some dishonesty, and do you have any understanding as to the motives?
I think it's turned into a bit of a game. So I've come across very, very gregarious people with my own eyes who've maybe sat with dozens of people saying they'd only met 3. And the purpose of contact tracing, as I've said, is to encapsulate the virus and stop it spreading. If I'm not accurately able to identify where the virus is and I let people walk along the streets, then they're spreading the virus to everyone else. So that's what it is. It's your patriotic duty to say what's true. It's not clever to misdirect and to hide the truth. It actually harms your friends' jobs and your elderly relatives' lives. It puts them at risk. So I know that people do play games, and I know people do try to misdirect and give us wrong numbers and forget who they've met. It's almost inevitable. Contact tracing's purpose is to encapsulate, and if we miss more, then we can't encapsulate, the virus spreads, and we head towards a situation where we've lost control.
We spoke a number of weeks ago, I'm going to say 7, more or less, when you said that there had been a new intake of phone operators at 111, and that might account for perceived inconsistencies between the messages emanating from 111 and the Contact Tracing Bureau as to what steps people being asked to self-isolate should take. I understand anecdotally, in preparing this program, I've spoken to a number of people about their experiences, and I'm told that some of those problems still persist. What would you say to anybody about those inconsistencies?
I can only apologise. I spend a lot of my time trying to clarify those inconsistencies because they come to me, and I do hear about people saying, but you said this or you said that. Some of them are genuine miscommunications. Some of them are, I've discovered, we had a letter which was to be given to employers, and in the early stages we omitted to put names of people down, and it's being photocopied and being used. So employers have come back to me and said, oi, what you're playing at, you should put names down. So it's an iterative process. We are only human, and we're trying to make things up. There's no playbook. I don't have a manual that I look up and say, what do I do next? We're doing things with best endeavours, and we're iteratively trying to improve those systems. So I can only apologise that it's not perfect. We aren't perfect. But we've done really, really well so far. You know, I would characterise our response to COVID as amongst the best in the West. In the East, they have a slightly different culture, and they're much more compliant as a population. They do what they're told. In the West, we're much more liberal and libertarian in our approach, and we have a lot of freedoms in Gibraltar at the moment. You don't need to go very far to see how liberal our society is at the moment, with being able to shop and actually go out for a meal. Those things aren't allowed in a lot of places in the same way they're allowed here. We've done that and managed to avoid any major harm to our population.
Public health as a function has obviously come into its own in recent months, but traditionally public health experts have always said that they need more funding, and the public health team in Gibraltar, I think it's fair to say, has been fairly small historically. Have you been able to grow that satisfactorily?
Yes, I've been able to grow it, but first thing you learn about economics is money is scarce. So I've been judicious in the way that I have grown it, and there are pressures in different bits of the system as we've grown. I've talked about the fact that we've had to grow our lab capacity. Now we're going to have to grow our testing capacity, and we're going to try to introduce a new testing system that requires some additional people to be able to address it. So I'm never 100% satisfied with what I've got, but I work with government to articulate what the needs are, and it never quite happens instantly. So there's always a bit of a lag. But I've found the government to be very supportive.
Are people being tested at the end of their self-isolation period before being allowed to return to their lives as normal? Somebody who has tested positive,
yes,
would they be retested before they go back into the community?
So the short answer I've just given you is yes. So what we've discovered when people have been self-isolating, so we have assumed that as a close contact there is a risk of infection, and if they then self-isolate, what we did in Surge 1 was we just let them out. This time around what we've discovered is that some people can be starting the incubation of the virus. So if we swab and test on the day that they leave, at day 10, we've picked up a proportion of people who are new infections. And in fact, something like a quarter to or 2/5 of our cases at the moment are coming from close contacts, people who we've already encapsulated, who we are testing on day 10 and then finding, gosh, you're positive. And that's personally a problem because then you have to isolate for longer. Mm-hmm. But actually from a societal point of view, we're stopping the spread of the infection.
Okay, so two things. You answered, I believe, referring to close contacts. Are people who have already tested positive, are they being retested before going back into the community?
They're not.
And they don't need to be?
And they don't need to be.
Not even if they have symptoms?
If you've got, so what you have is a positive test and you're isolating, and that isolation period is based on when your symptoms started. I know at this time of year with the allergies it's really quite difficult, so sometimes we just default to the swab test date as the first day of isolation, and you isolate for 10 days. In some places they're still using 14 days, but I've taken a risk-based approach on that. And if they have symptoms at any point in those 10 days, then we actually restart the clock at that point. However, if they are still symptomatic, and I don't mean minor symptoms, I don't mean things like cough and stuff, like a sniffle. What I mean is, if you are developing symptoms that are significant, then we ask for 2 days clear of symptoms before you're released. And the evidence seems to be that most people carry the virus for 14 days maximally. They carry live virus for 14 days maximally. What you carry after that are macerated bits of virus. So your test may still be positive, doesn't mean you're infectious.
Are new cases then linked to specific known clusters? I think you've said 2/5 more or less. But then does that mean that the other 3/5 are coming from wider community spread?
Yeah, they're sporadic. They're coming, as I say, we think that a lot of them are coming from schools, but there are a lot of them coming through the frontier. We know we've had just under a dozen cases coming from the UK. We've got cases, probably about the same number, coming from Morocco. The heart of Gibraltar society is free travel and trade. So it's not it's part and parcel of who we are. And I think that with that comes risks. And we certainly can't close the frontier at the border here, because a lot of our essential workers come through. So one of the things that WHO recommends for protection is close your frontiers. You know, Taiwan has done it, for example. We can't close our frontiers. So we have to live with the level of risk that's coming through, which is why contact tracing, isolation, testing are the ways that we mitigate the risks. And depending on how compliant people are with the advice we give them, and how compliant and truthful they are with where they tell us who's been in contact, then we can control it. If people don't, we can't control it. It will spread. It will be a collective disaster for all of us, actually, because who wants to go back to that nightmare scenario we had in March, April, May?
You referenced it earlier on, but you have asked some businesses where there have been outbreaks to close down for a number of days. Could you tell us what criteria you've used and how long you've asked them to close?
So we have, I've been very reluctant to do anything like that. So I do get reports of different businesses, and we go through a significant level of giving them time to comply. We give them advice, how, particularly with restaurants and bars, the Environment Agency, where the police go in and they educate and improve their behaviour. If some people are recalcitrant and just taking the mickey, if you want, for want of other words, then at some point we have to show that there is teeth in the legislation. There is teeth in the legislation. We can remove a permit, for example, or we can issue an on-the-spot fine. These things have been brought in reluctantly by government, because that's not the first instinct. We want people to do it because they see it's in their and their friends' interests. So we are prepared to do it. I have to basically work with people. I don't want to coerce people, and I say to managers often, you've got this amount of risk going on in your premises. How can you afford the potential legal costs of defending yourself if you give it to one of your clients? Most people see, actually, do you know what? Better to comply than to have huge legal costs. So I try very, very hard to work with businesses, because one of the principles I'm working on is, well, the first one is to save and not lose any life unnecessarily. The second one is keep our economic well-being, maximising that. And the third one is improve the well-being and health of our population, which is where the hospital, as well as the general well-being, mental well-being goes. Those are the three principles I'm using. So that means that the economic well-being is important to me, just as it is to anyone else. I don't want us to turn our economy down, because it's very, very hard to turn it back up.
Okay, well, we've got more questions about our testing and also about what you think might happen next, but we'll take a short break. You're watching Viewpoint with the Director of Public Health, Dr Sohail Bhatti, and we'll be right back after this very short break.